Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department. And on behalf of Mayor Strickland and Mayor Harris, I want to welcome you to the Joint Task Force update. I'm going to give just a few brief comments today, and Dr. Randolph will join me and add some comments as well. But we do anticipate there will be a lot of questions, particularly with news that vaccine is on its way to Shelby County, so we want to make sure we leave sufficient time for questions today. As of this morning, we have 56,820 cases. That's an increase of 893 reported in a 24-hour period. And as of today, we've experienced 752 deaths, which is 1.3% of our overall cases. One of the other things that I wanted to review are some of the indicators relative to the tripwires, and then I'll talk about the gating criteria in general. Our average of cases over a 7-day period is now at 670. That's increased significantly over the last 3 to 4 weeks. Our 14-day average of new cases per day is 558. Our reproductive rate is 1.06. And we always want that below 1, but one of the things we have to keep in mind is the number of active cases that we have currently really grows exponentially when that number is above 1. So at the current time, we have 5,434 active cases, and each of those cases has the potential to spread it to at least 1.06 individuals. That would cause us to grow our cases exponentially in the upcoming weeks, which is critical. And our current positivity rate for the past week is 12.1%. But I just want to talk about the overall gating criteria. One, as we know, is the scope of the pandemic, which I highlighted some key indicators relative to the pandemic. But we are seeing a surge that is related to the Thanksgiving holiday, and we know we're going into the Christmas holiday, so this is a predictor that we're going to have a significant number of cases as we go into January, and that's critical for people to be aware of that and know that we are experiencing a surge. The other gating criteria is testing capacity. We have tons of testing capacity. So really are encouraging people to get tested and know their status. The city of Memphis is offering significant testing on the weekends, and there is now some open drive-through sites that are available from 5 to 8 in the evening. So we really encourage people to get tested, and particularly those under 40, where we know there's increased transmission occurring amongst that age group. The third criteria is hospital capacity. And we meet regularly with our hospital leaders. They participate as part of the Joint Task Force. And my takeaway for this week is, while the systems are experiencing some strain because of the number of cases, it's really important that people continue to receive and seek the care that they need. People have many other illnesses, particularly this time of year. People experience heart attacks, strokes, trauma, and other things that I've mentioned before. And it's really important that people seek care, and the hospital systems are doing everything that they can to meet the needs of this community as individual health systems, but also as a collective group. Also, as we look at staffing for not only the vaccine administration, but for the healthcare systems, our local nursing schools, pharmacy school, medical school are all looking at what they can do to be of assistance as well. So it's really a testament, again, of our joint efforts to assure that everyone in our community has an opportunity to be healthy and well. The last gating criteria is public health capacity, and at the current time, we are, as other systems, we can be a little bit strained if we receive 800 or 900 new cases per day, but we are working very closely with the labs as well as other partners in the state of Tennessee to receive reports in a timely manner, work on assuring that people get notified and are placed in isolation and quarantine early, and using the contact tracing information to help us guide our interventions moving forward. I'm not going to go through all the list of things that everyone knows that they should be doing this holiday season. I just ask you to consider what you can do individually to assure that you're healthy, your family is healthy, and your community is healthy. And I'm going to turn it over to Dr. Randolph, and then we'll open it up for questions. Thank you.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. This is Dr. Bruce Randolph. I'm the health officer of Shelby County Health Department. I just want to add a few comments to what Dr. Haushalter has stated. As you well know, that we are experiencing increasing number of new cases. And if you refer to the health directive, number 15, there in it spells out some criteria that must be met in order for us to respond in certain ways in terms of setbacks. She reports today that our average 7-day cases is 670. And our 14-day average is 558. If you refer to the criteria that we have in the health directive, one of the setback criteria is that if new cases reach 650 cases per day, there would be certain actions we would take, such as in and rather than set a set number of people who can gather, we said that that number is determined by how many people can be separated 6 feet apart. So we've instituted several measures, and truthfully, fellow citizens, it's up to you as an individual to determine what steps you would take to ensure that you are safe, that you are healthy, that you do not become infected with the virus. So it's up to you to make sure that you avoid crowds and gatherings. It's up to you to make sure that when you go into a restaurant or any other establishment that you wear your facial covering at all times unless you're actually in the process of eating. It is up to you to make the decision to maintain 6 feet separation. And so if we're going to change things, we're going to slow this increase that we're experiencing in cases, it's up to you. I think we as a health department has done all that we can do short of taking drastic measures of going back to safer at home and closing down things. As I stated before, that is not a desire of ours. That would be a policy decision even that we would not make, but the policymakers would make. But it's up to you to determine whether we have to take that step or whether or not we can control things with our individual efforts. The health directive is very clear on things that you as an individual must do in order to play your part in staying safe. So as the vaccine becomes available, it's up to you to get vaccinated. It's up to you to get tested. And it's up to you to do the other things that's needed that we all may be safe and healthy. With that, I would stop and entertain any questions you may have.
Brad Broders, Local 24.
Good afternoon. First question is to Dr. Haushalter. I know obviously a lot has changed since the last briefing on Thursday on the vaccine front. What are any new details you can provide on the vaccine front, the distribution breakdown, any new timelines to municipalities, and potentially how Pfizer and Moderna will be timed out separately if it gets the authorization on Thursday?
Sure, I'll share what I can. The allocations still are in flux. The state determines what those allocations are. The Pfizer vaccine obviously was the first shipment that was approved by the FDA and then obviously moving very quickly out of Michigan. My understanding is some of that shipment has arrived to some of our healthcare systems locally, and the rest of that will be forthcoming relatively quickly. That's intended to get to those high-risk healthcare workers and potentially patients who are very high risk. Some of the healthcare systems may also receive Moderna once it's approved, and some of that has to do with the storage of one vaccine over another. All of us who are receiving vaccine had to send in an application to the state health department to be able to receive vaccine, and that's for every site that we would have vaccine. So like the health department, each one of our clinics has to have a separate application. And based on the refrigeration that's available, storage that's available, then there's a decision from the state of whether one could receive Moderna or Pfizer. So some of the healthcare systems will likely receive Moderna as well. The Shelby County Health Department will receive Moderna as well. We anticipate beginning to receive some of our shipment prior to FDA approval so that we have it and are ready to go. We have an internal team that's led by our manager over emergency preparedness and our chief of nursing. They've been planning for many weeks. We are expected at this point, if the vaccine is here and we have FDA approval, that we can begin vaccinating as early as the 28th. We're coordinating with the municipalities, particularly their EMS providers, to make sure that they're first in line. We will receive our vaccine in dribs and drabs, so we know that, and so we'll be working to get those high-risk populations in 1A1 within the supply that we have. I also understand safety net providers and some others are either finishing up their applications or have, so that they may also receive vaccine. So I anticipate it'll come in, as I said, dribs and drabs, but as we get into the first part of the year, I think things will be rolling relatively smoothly between all the various organizations that can receive vaccine. The key focus has to be getting information to people and getting them information that they need and want to make an informed decision. There's a lot of questions that people have, and so we encourage them to talk with their healthcare provider. They can also go to the City of Memphis COVID-19 website or Shelby County website, shelby.community, and there will be information available there as well as additional resources from the state website and the Tennessee Department of Health website. So that is a lot of information. It's not maybe as detailed as you want, but continue to pay attention. We'll give you the updates as we have them.
Appreciate that. And that's follow-up, Dr. Haushalter. Not only have we had 3 of the 4 highest one-day totals in the past, 4 days, but there's a lot of testing that's been going on as well. Do you see just any broad trends of what we're seeing? Is it community transmission and the testing is a little bit of both as we're seeing the high marks in recent days?
So the community transmission is represented through testing. So the more people that we get tested, we have a more realistic view of how much transmission is occurring. But I think it's important that we note we have significant community transmission. This is not just because we have increased testing. What the testing is allowing us to do is particularly find people who are asymptomatic and who are infectious to others so that they can get isolated early. But the takeaway is that we have significant community transmission.
Joan A. Lewis, WREG.
Hi, can you all hear me?
Yes.
Yes.
Okay. A couple of questions. The first being, I know when we initially talked about the vaccine, we spoke about Tennessee being one of 4 states to participate in this pilot program for Pfizer. Now that it's going to be coming here, are there any additional things or measures or reporting that you will have to do? Second question is the State Department of Health announced self-testing kits for the 89 communities not under the body of a local health department. Can you just speak to the benefits of our neighboring communities having increased access to testing as we are dealing with a spike and how that could potentially help here in Shelby County?
So the key to testing, and the reason we do so much testing, is case finding. We want to identify as many people as we can that have COVID and who pose a risk to other people so that they can be isolated. So the more testing we get to communities, the better off we'll be. for those counties that may not have access to a health department, having the BINEX testing, which is what I believe they're sending from the state, allows them to get answers relatively quickly and get people isolated relatively quickly. Your other question was about reporting. So anytime that we are involved in a vaccine campaign in partnership with the state health department, there is reporting that comes with that, including monitoring of actual receipt of the vaccine, whether it was stored properly or not stored properly, when it was administered and who it was administered to. And then I also understand the CDC will be tracking side effects in a new way using technology through texting. And so I anticipate we'll participate in that as well. But more to come on overall reporting as we, begin to administer vaccine and have updates on how that's going in Shelby County.
Michaela Watts, Commercial Appeal.
Yes, good afternoon, everyone. My first question is sort of a check-in on vaccinations and the level of hesitancy in our community about the vaccination. I wondered if the task force has their own assessment of the community confidence in the vaccine process, and where, what type of measures are you guys looking at to bolster confidence among the community?
Good afternoon. That's a great question. There's a variety of data collection tools that are being used to gather information from the community. There's a polling survey that was done earlier in partnership with the University of Memphis, and that was a very broad, would you take the vaccine if it's available or not? There's another survey in the field that is a telephone survey that the city of Memphis is leading that looks at whether or not people would take the vaccine, and then particular barriers that they see or things that might contribute to hesitancy. We are also working with the University of Memphis to host what we call listening sessions, very much like a focus group but less formal, to have direct feedback from community members. And we'll be working with faith leaders to identify participants from their community as well as elected officials to make sure we get good representation from our community. Also, there's additional data that has been shared from the federal level, particularly the CDC and NACCHO, another organization that's a public health organization, have shared some insights into those things that contribute to hesitancy. I do think it's important that we look at our own community, because every community is quite different, and make sure our talking points are directed towards the questions that our community members have. I also think we have to answer questions of leaders. Clearly, we want leaders in a variety of areas, including faith leaders, medical leaders, nursing leaders, and so on, to be ambassadors for the vaccine, but they also need information. So the communication piece is a big component of the vaccine campaign. We're moving forward with that, but I would say continue to watch, because that'll evolve as we have more information.
Thank you. And for my follow-up, the ongoing talks with the surrounding medical schools, are those yielding any signs that, staffing relief is on the way for our hospital system, which seems to be edging closer and closer to full capacity?
So one of the strengths of our community is we have a really strong medical school, but we also have a pharmacy school. We have multiple nursing schools or colleges of nursing. We have a physician assistant program, and we have others, occupational therapy, physical therapy, and so on. So yes, those conversations are yielding fruit. The question is, how do students potentially get assigned to assist? It's somewhat easier, this would be my opinion, to have a student assist with vaccine administration if they're already trained and know how to give an injection. It may be more challenging to put that student at the bedside to provide care to a very complex patient. So there's some training modules that are being developed by the schools. There are some decisions the schools have to make about how those students would get credit for what they're doing, but everyone is in agreement that the schools will provide whatever support they can to be able to help with the staffing shortages locally and to improve our response.
Kendall Downing, WMC.
Good afternoon, everyone. My first question is around the health directive. I was wondering, was there enforcement this weekend? Was anything closed? And is there a new directive coming this week? And then I have a follow-up.
Good afternoon. Yes, there was enforcement this weekend. I apologize, I don't have the data in front of me. We've made a significant number of inspections over the past several months, well in the thousands, and the majority of those inspections show that businesses are compliant. But there are always a few businesses that are not compliant, and some of those were able to provide education and technical assistance, and they come into compliance quickly. Others have to be closed. Dr. Randolph and I were just chatting. Our recollection is around 5 or 6 businesses were closed this weekend, but we can clarify that. 6, did have that clarified. So we know 6 businesses were closed over the weekend out of the multiple businesses that were visited. And did I cover all your questions?
Well, the other was kind of around a new directive. We
Okay.
heard that a new directive would be issued this week. Is that a possibility, or it sounds like maybe not? And then I do have a follow-up.
We have been drafting a new health directive, and that's number 16. Our primary focus was on clarifying language based on feedback that we had received on 15. But we also wanted to make sure we were covering events in a clear way for the public. However, as the numbers have continued to go up, we are holding the health directive to make sure if there's any other clarifications that need to occur, we do those all within one health directive. So while we thought we might release it this week, we may not. I will be honest, at the current time, we just really urge everyone to continue the course. What's in the current health directive is still what's important and necessary. Masking at all times is important. You should only take your mask off when you're eating. That was the biggest clarification that people needed. And while there is significant debate from the public about whether or not they can wear a mask in a gym, gyms are very high-risk facilities. Fitness facilities are high-risk, so people must wear their masks. So those all stand. And so the sense of urgency to release it immediately is not as eminent as people may think. And you had one follow-up.
Yes, I did. I was wondering if you all could clarify the people that the health department will be responsible for vaccinating in the 1A1 phase that the state has laid out. Will you all take the first responders and long-term care facilities and, hospitals handle their own patients? I was just wondering if that could be clarified. Thank you.
Yeah, hospitals handle their own. Yes, we're responsible for first responders, and we'll be responsible for some other facilities, not limited to long-term care facilities, such as facilities for the developmentally delayed. That will evolve as we get more vaccine, and we'll give more updates as we receive more vaccine and know which populations we're targeting at any given time.
Jacob Steimer, Memphis Business Journal.
Yes, I wanted to start by clarifying one thing Dr. Randolph said. You said that a return to safer at home is a policy decision that you all would not make, but the policymakers would make. Isn't that your and Dr. Haushalter's responsibility to protect the community's health? I thought state statute gives kind of these types of responsibilities to you all, not, elected officials.
So I'll respond to that, and then Dr. Randolph may want to respond as well. And I've said this publicly before, our system is one of checks and balances. So we do have authority as public health leaders. There's authority that's granted to the health department. There's authority granted to me as the director, and authority granted to Dr. Randolph as the health officer. And we can, as a result of an outbreak or an epidemic, establish interventions to reduce transmission. Some of those interventions are clearly policy. For example, restricting the hours that a facility can be open is a policy intervention, but it's time limited. It's not a law. And then obviously the elected officials have authorities under their executive powers, particularly during an emergency, where they can also implement interventions that support or complement those of the health department. And then there are things that the commissioners and others. So all of us have some power. I would say, and again, Dr. Randolph can speak for himself, is that at the current time, we know that there is a significant challenge to the authority of any health department, not limited to ours, and that it's going to be critical if we have to take broader interventions, that those are led by our elected officials, particularly our mayors, and supported by our mayors. But I want to reinforce what has happened throughout this whole process locally. Our process for decision making and how those decisions come into the health directive has always been a robust process. We have never sat in our offices and issued policy. We work closely with the mayors. We work closely with others. We ask for input from colleagues. We have discussion and debate about how well an intervention will actually impact the pandemic. So we anticipate doing that as well. But if there are more stringent interventions needed, then we would also ask that our elected officials support us in that, or that they take the lead on that. So I'm going to ask Dr. Randolph to speak for himself.
Yes. So if you recall, when the stay-at-home order was issued in the beginning, it was not just the health department who issued that. The mayors issued it, and on the state level, it was the governor. And so we recognize in public health, the public part of that is the people and the policy makers. I view public health as being the intersection of health and policy, specifically politics. And so we acknowledge and understand that we don't make rules or requirements in a vacuum as Dr. Haushalter, but that we understand that there are public ramifications of decisions made. If you read the state statute carefully and the rules, it states that the health officer, for example, are to implement measures that are least restrictive. And that's what we attempt to do, and we progressively take steps as determined by the data and the perceived imminent health threat. But when it comes to making some decisions that's going to affect a great number of people in various areas of life, we want to make sure that it is indeed based on data, rooted in the data suggesting that an imminent threat present, and make sure that it is rooted in policy. And we do not make policy. We advise, we recommend, we implement measures from a health perspective, but when it becomes a public policy that's going to affect people emotionally, physically, financially, etc., economically, then it requires a greater input than just what the health department has. I hope that answers your question.
I mean, wouldn't you all be the ones that would have that data to make data-driven policy? It seems like if public officials are weighing in, it could be somewhat of a, well, what does the public want when these decisions seem to maybe be best made by experts?
Well, the thing is that when we look at the data, we see the numbers of increase, and we've implemented various safety measures that individuals, if they all would follow, would make a significant difference. The reality is that with escalating numbers as we're facing, and even based on the health directive, what we've stated is that if our new cases get 750 or more, One of the response is to return to safer at home. That would be a recommendation, but also the policy makers would have to implement and endorse that.
We are out of time. Are there any closing messages today?
My only measure is that we're really at a very critical point in this pandemic. Certainly it's not time for us to take our foot off the gas, the brake. Because we got the vaccine does not mean that it is now time that we just forget about the other measures that we have in place. Matter of fact, it was going to become more important, very important, that in addition that you get the vaccine, vaccinated, that you also continue to wear your mask, continue to practice social distancing, continue to avoid crowding and gatherings. And this upcoming holidays, we encourage you and beg you to not gather, because we're finding that a lot of the transmission is occurring within the homes, among family members gathering. And so we ask, wear your mask, keep the distance, and stay safe.
Thanks, everyone. We'll see you back here on Thursday.